Ultrasound of the lateral hip, looking at gluteus medius and minimus. I'm going to start in short axis on the femur. I'm going to come up lateral femur until we see the greater trochanter. As you come through, you see a particularly prominent point here, and that's the divide between the anterior facet and the lateral facet. Now, note that the lateral facet actually faces quite posterior in this case. So you focus first on the anterior facet here in short axis, and you start by making that level, horizontal on the screen. Just make sure you've got enough jelly there. So the facet needs to be horizontal. You then need to turn the probe so the face of the probe is facing towards the anterior portion of the iliac crest, and that brings the gluteus minimus tendon here into a true short axis. Now the test for this is that you move the probe proximally and distally, and the internal architecture of the tendon should stay in the same place. And this is the short axis insertional zone. Tissue coming across the top obliquely is the gluteus medius muscular tendon, anterior portion of the gluteus medius muscular tendinous junction. So coming back to the gluteus minimus, as you follow that proximally, it dives down under the bulk of gluteus medius, and you'll see, and you have to keep adjusting your angle of the probe, you'll see that it spreads out into this thin aponeurosis that lies over, superficial to the muscle belly of gluteus minimus. So we go out there, and this is all gluteus minimus, it's all gluteus medius over the top, and you can follow that out as far, and here it is originating from the crest, and you can follow that all the way up. Coming back down again, you see subtle change in the thickness of the aponeurosis overlying the muscle, and this eventually becomes the tendon, and you follow that into its insertion. Once you've got the direction of travel of the tendon, it's very easy then to turn into long axis, and in a slim patient you can get nice views with the tendon nice and parallel, and again you scan all the way through the tendon. Moving on to gluteus medius, you go back to your picture of the two facets in short axis on the femur, and you move to the lateral facet, which again looks very posterior. We'll get some more jelly there. And you actually have to angle the probe quite steeply posterior in this case to get the lateral facet there. And here you see the fibres of gluteus medius coming in obliquely. Again, the anterior fibres of gluteus medius that attach onto the lateral facet come from over the top of the gluteus minimus and attach onto the anterior portion of the crest. So you have to again turn the probe quite radically to anteriorly, and then you follow these fibres out. The probe wants to come round and scan them obliquely, so you have to be quite firm and make sure that the fibres of the tendon are horizontal here. And again, you can scan through that insertional zone. You see that whole broad lateral band of the gluteus medius inserting there. We'll look at long section in a moment, but to look at the posterior portion of the gluteus medius, you go to the posterior part of the lateral facet, and it's these fibres here. But if we follow them out in the same direction, I'll have to drop the depth down a little bit. You see they diverge, these fibres diverge slightly, and that's because they're going more posteriorly. So you have to change the angle of the probe here, and you can scan this, and there you see the short axis of the posterior portion of the tendon, which has a slightly different architecture. And again, you can follow that out. This is an interesting point where you've got the gluteus maximus fibres moving obliquely across the screen, and here you have the two layers of gluteus medius, the superficial and the deep, forming around the aponeurosis that becomes that posterior portion of the tendon that's inserting here, and you have to work quite hard just to get the probe into the right angle. At this point you turn into a long section, and you see the fibres of gluteus, the posterior fibres of gluteus medius nicely there. Coming back anteriorly, you have to remember to turn the proximal end of the probe back towards the anterior portion of the crest, and you see here, see that transition from the thick posterior tendon to that thin aponeurosis that makes up the anterior portion of the gluteus medius before it inserts. And again, you scan all the way through there. And I've actually drifted slightly further down because it's inserting all the way up here. So I can just optimise that picture a little bit. That's the gluteus minimus, so I've come too far forward. That's this, you see that characteristic feather-like appearance of the gluteus medius with the fibres joining muscular tendinous junction, this fibrous band coming up here. And that's your long section through the gluteus medius anterior portion. So we come back to the short axis of the femur, come up, find the prominence that divides the two facets, and you've got the gluteus minimus on this side and the gluteus medius on this side. The iliotibial band lies directly above there, and if you move the hip, rotate the hip by lifting the ankle, you can see quite clearly the plane that moves where the cuff of the hip moves under the iliotibial band, and that is the plane of the bursa. If you're going to see fluid, it can collect just anteriorly to that, or more often you see it just posterior to the iliotibial band. But the plane you're looking at, I'll just move the cursor down, is just this one here. Yeah, you can see that.